Welcome back to Great Day Houston. There are many reasons people struggle with their teeth. Issues can take away the ability to eat properly. Discolored or missing teeth make you want to hide your smile, and it can be painful. Our next guest has helped thousands of people like Evelyn Gomez. He restored her self-esteem with functional and pretty teeth again.
What do you think? Smile.
Oh.
Smile, smile. Smile big. What do you think?
I love it.
You love it? Look good?
I could find a boyfriend.
Aw, happy tears. Dr. Ali Obeidi, with Elite Dental Specialist, was able to change Evelyn's life by doing what he loves best. Dr. Obeidi is here with Evelyn, who hasn't stopped smiling since she arrived this morning. And Evelyn, okay, you're in tears right now. What this is and Dr. Obeidi and I were talking about this earlier. Teeth are very emotional because it's part of our face, it's part of our presentation to the world.
Yes, it is.
Yeah, and part of it's the self-esteem, just to be able to smile and greet people. You come across as a very happy person to me. But the other part is the functionality of it. You struggled with just doing something as simple as eating.
Yes, I struggled a lot with I had dentures, and I have to pop them in and put them glue on, like a glue on it, and then to keep it up. And then the taste of the food, you really cannot taste anything, because the upper part is where you really taste more of the food and the tongue, you know. So usually the whole mouth. And now that this wonderful, wonderful doctor took care of me and gave me these beautiful teeth, I'm the happiest woman in the world.
Aw, that says it all. This is why you do it. You're tearing up a little bit too here, Dr. Obeidi.
I do.
Yeah, all right. Just a little bit about you. You used to be a traveling specialist for years, helping general dentists, and you realized how many patients didn't really understand the options they have.
Exactly.
And why would we, right? We don't know until we need something, but we need to be educated, and that's part of what this segment is that you want to do. You're a surgical prosthodontist, which a lot of people say is the architect of the smile.
Yes.
What types of things do you specialize in?
So prosthodontics, actually, you know, I'm a part of American College of Prosthodontics. The motto of the organization is our specialty is your smile. And we actually working around whatever needs to be done for your smile.
Yeah, missing teeth, jaw structures.
Exactly.
Diagnose and treat and replace and improve the function and appearance.
Yeah,
right?
and then most of our cases are more complex cases. The cases that usually general dentists, they cannot handle it. They are not trained for it. So usually the general dentists refer those patients to us. A patient comes to a general dentist, and a general dentist say, "Oh my gosh." Sometimes they say, "Oh, what can I do for him?" Those patients, you know, that general dentists refer.
Like, send the tough cases to us,
Yes,
right?
send
Right?
it up.
Yeah, but you go through extra training, about 3 years of advanced training, and of course, anytime something new comes up, you go and take advantage of that training as well. And so, the thing right now is not just implants, but how we place those implants, which has become amazing. A lot of people have been told you don't have enough bone for implants, and you can work your way around that as well. All right, Evelyn, when did the problem start with your teeth?
The problem started when I got that denture in my mouth.
Yeah, but you got a denture because you had problems with your teeth before that, right?
Yes,
Yeah.
I did. They were like getting like cracking and all that stuff. Like, it's just like my teeth were getting loose. So
yeah, and it just eventually took a toll on you.
Yeah,
and now, as we just saw,
I just told the doctor, take them all out and give me some dentures. But then the dentures were kind of not easy to use.
And Dr. Obeidi, the thing is, a lot of people use that stopgap measures like the dentures and things, and they can get you through some things, but sometimes they waste money on what's going to be temporary.
Yes. Dentures are made of plastic, basically. I have some samples here for you to see. They are like
right here,
like this. So they just made of plastic. They don't change their dimension. If you lose weight, they're gonna get loose. If you gain weight, they're gonna get tight and bother you. They are the cheapest way, and we call it the dentures are replacement for no teeth.
Yeah.
it's not replacement for your teeth.
Right.
Dentures will give you only about 20% to 30% of the function. These are the cheapest way, the cheapest option for teeth replacement. They can do the whole set of teeth as a complete denture. They can restore some of your teeth that you lost. We call it partial denture. Even one tooth. This is the cheapest one, which we don't recommend. The flippers.
Flipper?
Yes, that is a kind of flipper.
Yeah, and the thing is that again, it's not affixed, so it has the possibility
every
of
night.
falling
Every
out.
night, patients who wearing any kind of removable appliance, they have to take it out and put it in a glass of water. And most people like Evelyn was used to have a paste like these to put it in the in the denture like that.
That just doesn't look fun to me. Yeah.
It's nasty. The taste is just like.
All right. So obviously, Evelyn is one of many unique cases. When people come in, everybody's different, right? There are different methods of how you can address their issues. Let's go through some of the things that you have done with patients. Luceria is one. So describe the issue and the procedure that you did right here when we get this video up.
Okay. So this patient was a businesswoman having her own shop. She had lost some teeth. Other teeth were in bad condition. She was wearing a removable partial denture, but she want to have some better treatments.
Wow,
so
look at the
look at the difference. She looks so much younger. It's changed her life. Happier, and make her appearance and customer service better. She can talk to the customers. She can do better sales.
And here's the thing. Unfortunately, people make judgments about people when they don't have that smile, that's not missing teeth or having problems with them. And so when she feels better, she presents better to people with more confidence, right? All right. And then Fonfet, the next one here. All right. There we go.
Yes. So she's also a businesswoman. She's a chef, and she had all teeth bad due to the gum disease.
Wow.
And this is what she became. She looks so much younger. She can enjoy her own food.
Yeah.
She was a chef, but she couldn't enjoy her own food.
Which is another issue. Oftentimes people will they work around the problem eating soft foods, a lot of carbs, a lot of pastas and things like that, because they can't eat hard foods, and that impacts their health because nutritionally they're not getting a balanced diet. All right, let's get to our next patient here, and oh geez, yes.
So she was a medically compromised patient. She had a patch, IV patch, permanent IV patch, needed to access to her system through IV. Look at what is the changes from this to that. She lost some weight. She become a different person. She's so much happier. She's so much chill now, and see the difference.
Yeah. I was looking earlier. I said, "Oh, geez." Earlier, I was trying to think of how does she eat like normal foods. But what we can see how the teeth don't look right or might be missing. But what we don't see through TV is the pain that a lot of people go through as well. It's just painful in the mouth. All right, and then finally, Jennifer.
Okay, so this young lady unfortunately suffered from a lot of caries and cavities that was mistaken, and it was not taken care of during her teenage.
Because it just gets worse. Here's the thing, it's
just
progressive,
get worse,
right?
and worse and worse, and it become to a point that she gained a lot of weight. She was disassociate herself from the engaging with people, being social, and things go south.
Yeah.
Little by little. People
get depressed.
Exactly. After this procedure, also with the help of psychiatrists and other healthcare provider, she became a totally new person.
Wow. All right. And Evelyn, you understand that totally new person part. For you, I know there's somebody watching this morning who saw basically their story up there on the screen. and they're putting it off because we compensate for things. I've done it myself. Oh, I'll just chew on the left side, or I'll just do this, or I'll do that. Again, it's not getting any better, but what do you have to say to somebody who's been putting it off? And sometimes it's because they're afraid to go to the dentist, but modern dentistry, I gotta tell you, if you're afraid of pain, the pain generally is not there anymore, and modern dentistry has been amazing. What do you have to say?
I gotta say that it's worth it because it's painful, but at the end, you get this beautiful smile.
It's painful when you are not doing anything about it. Yeah, but when you get in, they knock you out, and you wake up with that smile that we saw that you had, and we're actually crying happy tears. Yeah. All right. Some things to keep in mind when you're choosing an implant specialist, because as we said earlier, not everybody's trained in this. And I got to tell you, I have a friend who told me, she goes, "Oh, yeah, I'm getting an implant." I go, "Who are you going to?" And she goes, "Well, this person, they've only done one implant before." I'm like, "You might want to do a little research." But you say first, research the dentist, find out what their education and experience is.
Exactly. So, believe it or not, Debbie, in dental school, the education dental students are getting during the 4 year of dental school is a lot of information, but the hands-on skills mostly basic, mostly cleanings and fillings and small restorations, and basically a general dentist is designed to help community to correct the basic needs for people. There are 7, 8, 9 specialty in dentistry who, when a dentist is enthusiastic about a process, a part of the a job, they go to a intense training in 3-4 years on that part. Yes. Yeah. So prosthodontics, periodontics, oral surgery, orthodontics. You're familiar with these. People like me we're going to intense education, intense classical academic residency.
Yeah.
It's different than a weekend course.
Yeah.
Okay, so some general dentists, they go to a weekend course to do a certain procedure.
Yeah.
I'll give you an example.
Yeah.
God forbid.
We're running out of time, but I'm going to round out with the other things that you say to look for. How does a doctor treat you? Like she said, you're wonderful. Do they explain the procedures? How much is done by assistants versus you? And what equipment and technology is used? You have your own labs as well, so you can get things done at a quicker time as well. Thank you so much for coming in here and educating us on this, because we're living longer. We're going to outgrow our teeth at some point, or outlive our teeth, I should say. And so we might need some of these things. Let me just end with Evelyn. She says now she needs a boyfriend. She is a Gemini, everybody. But anyway, we'll bring you back to the Valentine show. Elite Dental Specialist has an exclusive offer for Great Day Houston viewers. Call to make an appointment for a one-on-one consult with Dr. Obeidi, which includes assessments and 3D cone beam radiography. The consult fee and 3D x-ray are a $450 value, but you can get it completely free by calling right now. You must mention Great Day Houston to receive this offer. Call Elite Dental Specialist. Here's the number, 281-397-3352. Again, that's 281-397-3352 to secure your spot right now. And for more information, visit their website at elitedentalspecialist.com.